So we all know of the well-known virus COVID-19, which is an illness caused by a virus that is spread from person to person. The symptoms vary from mild to severe, including headaches, body temperature changes, and the list goes on. Testing is recommended for anyone with symptoms or anyone who has been close to somebody who has been exposed. Jose, an undocumented Mexican, was diagnosed with COVID earlier this year. His children, however, were born in America, and he wasn't feeling well in late April of 2020. However, he was scared to seek help. With the deaths being higher at hospitals, he was fearful that he would be into that category. Also, with him being undocumented, he assumed that his treatment would be worse and unfair. He also was fearful of a high medical bill. With him being the main provider of his household, he didn't want to put that pressure onto himself or his family. He, however, did go to the hospital. While he was in the hospital, he did have family members that lost hope in him. His children even assumed that he was going to die. After 3 months of being at the hospitals with no visits, he was able to receive video calls, and he later came home to a family that gave major assistance. His wife learned how to properly insert the tubes to give him medicine and food, and his kids took over the medical bills and the bills of his household. However, with his family being helped, they also needed outside help. Nurses came by periodically, and the funding for his medical bills were very confusing within the CARES Act, so the nursing part did have to get cut out. Released patients are told to be most dangerous because of them having pores that are so open. They're more likely to give their virus onto people, such as a stranger. Bob Shia, which is a co-founder of the nonprofit Devices for the Disabled, donated to Jose. He donated a shower chair as well as a wheelchair and other medical devices. She is based in Chicago, and his main group is undocumented immigrants who need medical assistance in Chicago. Latinos and Blacks are at higher risk due to the similar factors, including crowded homes, lack of insurance, and multiple generations. The multiple generations play a key factor because a 60-year-old could live in the same house as a 1-year-old, and if the 60-year-old is taking care of the 1-year-old, it's very likely for that 60-year-old to give the COVID-19 to a 1-year-old. Everybody gravitates to the baby, so it's easy exposure within the household. Also, those two groups are likely to have careers in the job fields of high exposure, including construction, cleaning industries, meat packing plants, and as far as Jose, restaurants.